Welcome to the Concussion Fix Podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that has helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our experienced clinical team, Dr. Paul Hrkal, Melinda Cranin-Hill, and myself, Dr. Cameron Marshall, we're here to share insights, empathy, and a clear path forward. In order to protect the privacy of the members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews and see if it's right for you. Whether you're looking for answers, hope, or just a little bit of encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
This is maybe a question for Melinda. It's or all of you. Um, because concussions are invisible, really, and the symptoms can kind of go on. Um, I'm finding it difficult to get the support I need from my family, because they've never been through it. And I think a supportive environment is probably one of the biggest factors to psychological and just recovery success. And they don't understand really. And I think it becomes more difficult as things, as symptoms continue to go on. Things are more expensive and just still getting treatment. It's something that's not like just you do it, it's done, and it's over. It's going on for a period of time. Um, and it almost seems like recovery is a full-time job, keeping up with going to neck, going to a psychologist, making sure I exercise every day, meal prepping, everything. So, but life goes on, like especially a life with small kids and a family. And so I'm wondering, how do you really get this, or how do you explain to your family, or what tools can you use to get the support you need from them when it's hard, right? Like having a concussion is really freaking hard. It's hard on me and it's hard on my family. Um, so any thoughts on that?
Absolutely. Well, the first one is we did a live on this because it is such a big topic and important topic for everyone, and a question that makes a lot of sense, and a lot of our members have. I think Nikki's always on the ball here, and she put it in the chat box for you. It was the supporting loved ones um, on YouTube. I think we did a live as well, Nikki. If the
Yeah,
support systems.
that's the
You wanna do
same.
that as well?
Yes. Yeah, so I did one on supporting loved ones, and then we put it on YouTube
Okay,
so that other
that's yours.
people so that people could send it to family members rather than having them try to log into the platform and view it there. But I think you've done it before
I've
too.
done one too, yeah, supporting, support systems or something like that.
Yeah.
Okay,
So I
great.
would I would encourage you to send that YouTube link to your spouse and other family members that you want, and then also log into Melinda's section in the resources and check out her video there too.
Mhm. Yeah. The fact that we've done 2 lives means it's an important topic, right? It means that there's, this is a common question we get from a lot of members. It's really difficult to navigate, right? We think about before concussion, there's these sort of subconscious expectations that people have of you, your roles that you fill and hats that you wear in your family, at work and other places. And sometimes following concussion, those roles can't be, fulfilled in the moment. So kind of figuring out how to adapt to that, as you said, sometimes these symptoms can be invisible, which makes it hard for your loved ones to see how much you might be suffering or what's going on inside. And, the number one thing I always share is try to focus on communicating your needs. So sometimes we try to explain what's happening, and that's also very important, but can be a little bit of a longer journey. But if you can communicate your needs, right? So, for example, I'm having a really hard time meal prepping. Can we work together to figure out how to do meals for the kids? So, there's a specific request you're having in that you're identifying a need for your partner or for your family members that you're struggling to meal prep, for example. Now, sometimes, because concussion is so emotion filled, we can come at our family with, this is why I'm feeling this way, and it's so hard living with these symptoms. Absolutely, that's valid and needs to be validated too. But it doesn't always translate into your family or loved ones understanding what the need is. So the best way to sort of communicate and help shift sort of challenges you might be having in fulfilling certain roles and responsibilities is trying to figure out how to communicate it as a need versus an understanding of what you're going through. So you can kind of see those two things as being separate. Both are equally as important, but as far as getting some support, usually if we can identify a need, that goes a little bit better than if we're trying to help our partners and loved ones understand the emotional aspect of what we're going through. So that is equally as important, but a different skill set. So that may be something else, as we've talked about in our social support systems. Nikki put in here is in May 5th, 2022. I believe it's there that we talk about, how to communicate and help receive some empathy and validation for what you're going through, right? Empathy.
Right. That's the piece I feel is missing. Yeah.
Yes, so that one's a little bit different in the sense of not everybody understands how to be empathetic, or know how to support you based on what your needs are about how you're going through your concussion and what's been troublesome for you. So as far as empathy goes, sometimes I invite clients to show the video. It's not about the nail. That's on YouTube, and it's pretty funny YouTube video that essentially just speaks at a natural tendency for partners and loved ones and family to want to fix when somebody they love is hurt or suffering. And so it talks about how to navigate that, right? And I don't want to give it away because it's actually pretty humorous. I'll let you explore it on your own. Called "It's Not About the Nail," and it is really an illustration of how to provide empathy to someone who's suffering.
Yeah, it's interesting that you say what your greatest need is. And I guess because for me the most distressing piece still is really the just really mood dysregulation, and then that lack of empathy, right? Because like I don't like having mood dysregulation. My husband and kids definitely don't like me having mood dysregulation. They don't they're tired of me not having mood being regulated. But I guess because the biggest piece is psychological for me.
Mhm.
um it doesn't seem really straightforward about, it's not like something concrete like, oh, I need help with food or I need help with this. I don't really know what the need is there. Like, my need is to be regulated, which is not something that they could do for me.
Sometimes it might just be patience, right? Communicating that need for patience. Hey, mom isn't feeling right now. I'm going through something that's hard to see on the outside, but on the inside, I'm just not feeling quite right. I wonder if you can be patient with me. I don't know how old your kids are, but uh,
2 and 5.
yeah, so, that's a lesson that they have to learn how to be patient sometimes too, and, of course, I'm not a child psychologist, so I can't really comment on what the evidence-based strategies would be for that, but oftentimes it's sort of communicating, letting them know that's how you're feeling and, "Can you be a little bit more patient with mom?" Or, "It might take mom a little bit longer to do things." Sometimes kids that age even are willing to help, right? They especially 5, right? They're okay to help and they can kind of grasp that concept. So when you're going through something that maybe doesn't have a certain, uh, end point to it, it might just be helping them to understand, how to go about it. At 2, I don't know, probably not gonna be effective, but
it's more the spouse, just kind of like a constant questioning of, oh, is naturopathic like not really knowing, not really having looked it up, not really having done the research or been to all the informational sessions, and just kind of being like, oh, I don't really know that this is the way to go, but I don't really know where you should go. Just like a lack of empathy and support, or
Yeah.
wanting to fix it but not knowing how, and not necessarily offering helpful advice.
Yeah, so that might be, watching together that YouTube video. It's not about the nail. Maybe communicating that patience right now when, you can't necessarily regulate your emotions in the moment. And then for you, kind of looping back to that recovery mindset and saying, are there any skills in here that I can use to to ground myself when I'm around my family? What can I do to support myself in these moments when I'm around my family? And, it's not one answer here. It's going to be, peeling
Right.
back the layers of the onion and figuring out what skills and tricks and tools are going to be really helpful and supportive for you to navigate this with your family. So hopefully we've given
Right.
you a couple resources to explore.
Okay, thank you.
Just coming at this from the male perspective.
Mhm.
Because
Go for
Thanks.
it.
yeah, because, you know, we tend to be very logical and we tend to like question, is this right? Is this not right? What's the best approach? Um, so I think what would be really helpful from your husband's side is being able to understand what what concussion is and some of the science behind it. And so my recommendation on that would be the one that I did on the one that's on YouTube, for loved ones, because I really go into the science of why those symptoms are there and then what the treatments are and provide evidence on that. But another good idea would be to convince him to sit through the first kind of 2 modules of the program. So the one that talks about the science around concussion, right? What happens inside the brain when a concussion occurs, and then the persistent symptoms, because I go into each of the 5 drivers.
I think that's the difficult part, because I'm like, hey, what would really help me is for you to understand this. I've sent the videos like, oh, I don't have time to watch those. Or, I've read a book, The Invisible Disability, about this woman who had a concussion, like, oh, I don't have time to read that. Just this feeling of, and I was like, if I had cancer though, like, you would look up that kind of cancer. And he's like, oh yeah, totally. And
Mhm,
I'm like, well, this isn't really, just a lack of, like, I'm saying, hey, I need you to watch this, I need you to read this, like, this would be really helpful to me for you to kind of get a grasp on what's going on, so why I'm doing the treatments I'm doing,
right,
instead of just taking my word for it, but just not really participating as far as actually doing any of those, or that empathy piece of like, oh, I don't have time for that, like, that doesn't make me feel supported at all you
right,
know
right. I would try, like, what my wife does with me if she wants me to do something is she will, like, because if she sends me a book, I don't have time to read a book, I'm not doing it. Um, but if she says, "I really want you to see this," and she sits down with me, kids are in bed, rather than, like, normally our routine is we throw on some Netflix or something and just chill. But if there's something that she feels is important, she says, "I want you to watch this with me," and we'll sit down and we'll watch that. And so I think that might be a strategy that you could use just to like get him to understand what those pieces are, because if he's not fully on board with what you're doing and doesn't understand the science behind it, he's going to be questioning like, "Oh, naturopathic, why are we spending money?"
yeah, yeah, I feel like I'm swimming upstream.
Right, and but if he understands that and realizes there's a lot of science behind what we're doing in this, he might then say, "Okay, like, I'm behind you now, I'm supporting this," right? Because like, we come at it from a very logical perspective, and
Right.
we question everything, and we wanna make sure that we're not letting our family get taken advantage of, and they're not needlessly spending money on shit that doesn't work and whatever. So I would suggest just being like, "Look, I really want you to sit down. We're gonna watch this. I need you to understand the science behind it so that I can get you on board with what I'm trying to accomplish."
So the loved ones video.
The loved ones video is a good start, but even just if that doesn't go deep enough, I can't remember because it's been so long since I did it, but if that doesn't go deep enough into kind of the science, it may be worthwhile watching like what happens in the brain when the concussion occurs and then going through the 5 things that cause PCS because I really break down each one of those like in great detail. And if he gets that understanding, he might then just be like, okay, now I get it. And then he's just behind you rather than in opposition to you, constantly questioning everything you're doing, because that's just another uphill battle you have to fight. But if he understands as well, now that's why I made the video like that. I made it so that it would be more like explanatory for the people so that they understand like why are you doing the things you're doing, because there's a lot of science behind it and that's why it works and that's why I'm doing it.
Mhm. I think that's a great suggestion. One is, doing it together, right? And really emphasizing that point of sitting together and seeing if he could listen or watch certain things together. Because that also, brings the presence there for the 2 of you to really focus on what you're doing. And I also like the point around the education, right? Really that understanding of what's happened, to you from a science-backed or evidence-based perspective and seeing if that helps make a shift, right? And trying those 2 things before, seeing whether or not there's a willingness. And then if there's not a willingness by our partners, then we're having a different conversation and we can always loop back on that.
Okay. Thank you guys. That's really and so and well, should I watch the nail video with him too?
Yeah, it's a humorous video, so it really brings some lightheartedness to sometimes an expectation around, "I want you to be empathetic to me," but it just gives some lighthearted humor to, how to approach empathy.
Okay, next question is
Hi, everyone. I don't know if you recall, Dr. Marshall, I assisted a Q&A a while ago and I was having trouble with exercise, and we weren't sure if it was really the exercise or if it was the neck or something. And you also had recommended I go see Dr. Patrick Hrkal.
oh yeah.
So he did the complete screen, like for all the concussion, like visual, vestibular, all that. And so initially, I kind of passed uh, the VOR screen with like some mild symptoms, but like barely detectable. And then he started working on my neck. And then I came back one session. I was like, I really have this thing where like I kind of have like this, uh, like a something in my throat, almost like if my gag reflex is wanting to be activated, but not completely to the point where I want to throw up, just like a little, and um, and then I have like this pain on the right side of my head. And I said it happens like when I scroll on my phone, or when I'm scrolling on the computer or reading and stuff like that. So then he did this thing where this like, uh, the smooth pursuits, I think, with like the white and red scarf. And like, he did that and then it completely killed me. Um, so then he tried to give me some exercises, but it was too much. So then we kind of scaled back and he worked on my neck a little bit. And then he gave me another visual exercises to do that were not as stimulating, maybe. So it was okay. Um, and I also redid the Buffalo concussion treadmill test, and he does it with somebody that's not in his clinic, and then they give him the results. So I don't have the results, but like from my understanding of everything, I passed. Like I didn't have any increase of symptoms other than what appeared to be like cervicogenic tension, like something in my head going on, but like nothing else. Like, and it was no major increase. So I passed. So whatever was happening on the bicycle before was not related to exercise intolerance. It must have been the neck. Now, after we're working on my neck, it's just like I have so much trouble at work, like trying to, read or write or whatever. Like I just keep getting that kind of like ball in my throat and that pain on the right side of my head. Um, so I'm not sure, is it just because like is it the visual exercises are too much, because like I do them and they don't give me any symptoms in at all like during, and I'm like slowly increasing them, but like I still have no symptoms, and then everything's fine, and then I start to work and like after an hour like I'm just like ugh, you know um which was not my case like let's say 2 months ago. So I'm just kind of confused. Um, like, is it because the eye exercises are too much in conjunction with the work? Also, like now, since I passed the exercise, the treadmill test, like I'm starting to do just like light exercise in the morning. Uh, and I'm also only doing like 10 minutes because I know, like, even though I pass, like I don't want to do like half an hour and then I'm just going to be like exhausted for the rest of the day or something. So I'm just like trying to do it slow. So I don't know. It's because I'm doing the exercise and it's causing me to have something flare up in my neck that's causing my eyes to have more problem, like, or is it the neck treatment? Uh, I don't know if you have any advice, basically.
Um, it's hard to say what the one thing is that is driving this. Typically, like swallowing problems and that type of stuff can be like anxiety related. So, you have to consider that that can be a factor. Also, it could be related to just tension in the front of the neck. So, is he working on like deep neck flexors and SCM and that type of stuff in the front?
Yeah.
Okay. So, I mean, there could be something there. It could be that after treatment, sometimes you do get some, like reaction to it. Like if you get a really
Mhm.
good deep massage, you're going to be sore after, and that can cause like a little bit of local inflammation around that area. So it could just be a response to that. Um, that's all, you know, fine. Um, then the question is, okay, well, are the eye exercises too much combined with what you're doing at work? So you may want to just try playing with that variable. You might be like, okay, I'm just going to stop doing the eye exercises for a bit. I'm going to continue getting my neck treatment and then just go to work and see, do I have more capacity? Because if you think about it, if you have, let's use like the pacing points system. You have a certain number of points allocated for the day, right? And before, when you weren't doing the eye exercises, you could get through your workload because let's say your day of work is 10 points. But then you add in the eye exercises, which is another 10 points, and now all of a sudden you're blowing capacity. And what's the issue? Well, I don't know. So you just got to try and play with the variables, right? So exercise, not an issue. Great. If I were you, I would encourage you to build up your capacity every week. So don't just say, okay, 10 minutes is all I'm going to do because I don't want to be exhausted for the day. 10 minutes is fine for week one. Then you should move to 12 minutes. And you should just gradually increase that because the goal is to get, 30 minutes of moderate intensity exercise that, you know, does some things. You don't want to just be like, minimal. Um, and then in terms of eye exercises, you can try just saying, okay, I'm just going to cut these down or pare these back and see how I respond at work. Do I have more capacity at work now when I'm not doing these exercises? If that's the case, then okay, let's just stick with work for a bit. Then let's maybe start adding in one or two exercises. You know what I mean? Just little bits to increase your capacity over time, right? Like how many eye exercises are you doing right now?
I'm just doing, it's just two. It's like he gave me this piece of paper with like this checkerboard on it and a point in the middle, and I just do the side to side and the up and down
Okay, so you're just doing some VOR. How often are you doing that?
every day.
How many times per day?
Um, I was doing them twice, but I scaled back to once because I was like, maybe that's what it is. But I don't seem to have responded well to scaling it back to once, so I don't know.
Yeah, because this is going to activate your neck. It's also going to activate
Yeah.
vestibular and your oculomotor, your VOR reflex. Um, so I wouldn't think that doing it like once a day is going to really add much to the picture. Um, so yeah,
Well, I was doing it 3 times a day, and then I scaled it back to two, and now one. But anyways, I see him tonight, so I'll speak to him about that tonight. Yeah.
yeah, I mean it's so multifactorial, right? Like fatigue and energy can be related to higher
Yeah.
levels of anxiety, right? If
But
you're
like my energy is totally fine. I have no problems with my energy. It's just the pain,
what pain?
like in my head, that it's literally like it starts from the back of my neck all the way up to my eye, and then sometimes even in my face, like my goes down my nose and then around my cheek.
So it
And
still
then
sounds
I have that ball in my throat, like, and I know that the ball in the throat is like an anxiety thing, but like it almost feels as if the ball is on a specific side. Like that's why I'm like, it's not like, oh, you have that feeling when you're anxious, like that you have, but maybe
yeah.
it is subconscious. I don't know, like,
Oh, it still sounds very neck related to me. So just keep kind of getting the treatment, figuring out like, okay, what's missing here. Sometimes it's peeling back layers of the onion. Like sometimes you'll start with one form of pain, and as you get treatment, it switches to a different spot because you're changing things up. So it's just a bit of a process. I don't think that adding in one, VOR per day is going to do much in terms of aggravating things. If anything, it'll help to kind of keep things loose. And so I would just keep kind of doing what you're doing and let Patrick figure out, where this is coming from. When he treats you, is he able to recreate that headache pain?
sometimes.
Because like basically the treatment when I'm treating somebody, I'm trying to figure out, okay, if I push here, does that cause the headaches and pain that you're feeling?
Well,
If
he
so,
keeps asking me, and but it's hard. It seems difficult to reproduce. Like, where is it coming from? Like, it seems to be the SCM a lot, but he says like it's improving in terms of like tightness. It's not as tight as it was,
yeah.
but the pain is worse now. So I don't know what's going on.
Yeah, so it's one of those things like you work on the neck, when your eyes move, it activates the neck. So there's still some dysfunction there. So when your eyes are moving and you're scrolling and doing things at work, it's going to just, cause those areas of the neck and then you're going to get the pain. Right? So it's peeling back the layers of the onion, and sometimes it takes a little bit to get into the depths that you need to get to the issue that's there. So I think you're on the right track. Just keep kind of sticking with that. And don't be too concerned about the symptoms. Like that's just a sign that okay, there's still some neck dysfunction. I just need more treatment. Like don't get too caught up in thinking like, oh, something's really wrong. I don't think that's the case. Just neck dysfunction.
I'm trying to not do the something is wrong because I'm trying to not, the whole like your nervous system is more hyper
Right,
vigilant if you think there's a problem kind of thing. So
right.
I'm working on that.
Yeah, and then continue working on, breathing exercises and the stuff from Melinda's module to try and keep things balanced. Keep working on diet and inflammation because that has a huge influence on neck tension and joint inflammation and things that can cause those symptoms. So just stay diligent on the diet. Try to do things that bring you calmness and bring the nervous system down. When at work, try to take frequent breaks to just break up the, sitting all day. Just try to get up, walk around every 20 minutes, do a little bit of like pull your shoulders back and down, those types of things. That can just help to kind of reset things.
Yeah, I do those things. Um, and also, this is not a question, but just I thought it was interesting. He said that um, I have a longer leg, like one leg is longer than the other, and he said there was cases where like correcting that could help improve
Yeah,
uh, rehabilitations. I thought that was
yeah, yeah. Especially when things are one-sided, right? I see this all the time. Like um, usually it's not like a true leg length difference. Usually what it is the pelvis is a little bit torqued, and you can easily kind of reset that. Um, and I mean, it'll come back because your muscles are so used to being in a certain position that the first time you do it, you might get like a day and then it just snaps back because that's where your muscles are used to being. So that again, it takes a little bit of time to kind of say, no, I want you here. And then your body goes, well, I'm used to being here. And then you go, no, I want you here. And it just takes a little bit of time to kind of work that out. Is he treating your pelvis and SI joints at all?
yes.
Okay, good.
And then the other question is like, in terms of the pain, and now I don't know if you've treated this subject. It's been a while since I finished the modules, but I don't recall. Like, often they'll tell you like I know when you exercise, like if when you do the test, like okay, you can't increase your symptoms more than like 2 points or 3 points or whatever. And like everywhere you go, they'll tell you like your pain symptoms can't increase more than 2 on 10, like when you're doing something. And like I find that causes anxiety. Like, because at the beginning I was like, but what happens if I have more than 2 on 10? Like, is it the end of the world? So I don't think like that anymore. But it's just like I find it's hard because at some point even Patrick said like, oh yeah, if you're doing the exercises and it's more than 2 out of 10, like you can't do that. So, um, so I was like, okay, but I just find it's a bit of a anxiety causing point for me.
We're currently in the process of rebuilding the Concussion Fix course. So here's a module on planning and pacing. So basically, there's two types of maladaptive kind of people or strategies, right? Number one
Hmm.
is people that completely avoid any type of symptoms at all. And then the other maladaptive one is people that push too hard into symptoms, being like, yeah, my symptoms are increasing, but I'm just going to push through. I'm just going to push, push, push. Both of those are bad. You want to be kind of in the middle of that because if you think about it this way, if you're doing symptom avoidance, you're staying way down here. And what starts to happen is that this line gets closer and closer so that even less activity now provokes symptoms because you're staying so far below symptom levels that you're getting weaker, right? It's saying,
Hmm.
like, I don't want to go to the gym and lift weights if it's going to make me sore the next day. So what you do is you lower the weight so that you're not sore the next day. But guess what? You're now getting weaker even as you're exercising. So it's the same kind of concept. Now, pushing through is here's your line, and now you're going way up into severe symptoms before you pull back, or you're just saying, I'm just going to push through. What happens in this scenario is that your body goes into kind of fight or flight mode, and now it goes into like full blown like protection safety, and you have a crash. And then now you're in this situation where now your line is down again, right? So this would be akin to going to the gym and being like, I'm going to lift so heavy that I injure myself, right? Now I can't lift at all because now I have to recover from a muscle tear because I went too crazy, right? So what you want to do is this, where you want to push in to symptoms. You don't want to avoid symptoms. You want to push into symptoms. But once they start creeping up a bit, some people say 2, some people say 3. Like when I'm having people do vestibular rehab, I say go until your symptoms hit like a 5 out of 10 and then stop, let things calm down, do it again. And then get to a 5 out of 10, pull back. So that you're not getting into the severe range of like, oh my God, I've debilitated myself, but you're pushing into those symptoms and then you're going, okay, it's time for a break, right? You're sitting at your computer, headache's starting to increase. Okay, hitting about a 3 out of 10. All right, I'm going to go grab a water, go to the washroom, walk around, do some stretches, go sit somewhere quietly, just close my eyes, just relax for a bit, things calm down, and then I'm going to go back to it. Okay, things are creeping up again, getting a little bit sore. You might even do some self kind of massage on some areas to see if that can alleviate, right? But you want to just be pushing in, then pulling back, pushing in, pulling back, pushing in, pulling back. Because then what happens is that line gets further and further away. So it takes more now to cause the symptom increase. And now you're building capacity in a safe way without risking the setback that comes with overdoing it. And you're also not risking, letting things come to you because you're being so cautious. Right. So not to let it provoke anxiety, just in mind, be like, okay, my symptoms are starting to creep up a bit. That's okay. It's only up like 1 or 2. I can keep going. But now it's at a 3 or a 4. Yeah, you know what? I'm going to take a break now.
And I think like that's kind of what I've been doing. It's just like now that that pain seems something is obviously aggravated because now it's like I'll start working and it'll come up and it's not like all of a sudden boom it's a 8 out of 10. It's just like okay it's coming and I'll do my usual like okay take a break,
Yeah.
but then like I'll come back and it's right away back. Like it's just always there the second I start using my eyes.
Yeah.
So.
So I think again that's just like neck issues that need to be worked out. So do what you can, try to stay within that kind of peak valley type scenario, that Goldilocks zone. And yeah, just keep getting the neck work and keep kind of being diligent on the other foundational pieces and, keep doing things to calm the nervous system down a bit. And yeah, like you'll get there. So it's just kind of just time and patience at this point. You're doing all the right things. Just stick with the plan and try not to, add increased anxiety to it.
Mhm. Okay, thank you.
You're welcome. Okay, next up is
So I have a question regarding neck strengthening. So I've been receiving my neck treatments for the past 2 months, and I feel that I am 95% recovered. in terms of symptoms and things that I can do. Like I can do pretty much back to my previous life, back to factory settings to some extent. However, I do feel some headache every day. Not much, I would say, on a pain scale would be 1 or 2, but it's there. The sensation's there, as well as the joint restriction in my neck. That's there as well. Like when I get my neck adjusted or get treated, it goes away for, I would say, a day or two, and then it comes back. However, what my question was, given that I have some daily head pain, how can I determine when it's good to begin strengthening my neck? Do I have to be completely pain free to start, strengthening my neck? Because even if I wear my iron neck, I can feel the pain in my forehead and other parts.
Yeah. The treatment you're getting, are they doing soft tissue work as well?
So I go to a physio and a chiropractor. They do, like, they dig into my neck. They do mobility one, and the chiropractor helps with some massage in my neck as well as the adjustment. Yeah, I should ask them if it's soft tissue, but they dig into my neck and press stuff and try to create that pain in my head.
And are they able to?
Not all the time. It's just one time recently where my physio pressed down on my SCM, I guess, and there was a pain radiating onto my behind my eyes.
Yep.
But not all the time. Every time I do these sessions, I feel better
Good.
rather than in pain.
Right. Good. So I think they're on the right track. They may just not be digging in hard enough. Like usually when I'm treating somebody, they're like screaming, like, ah, as I do it, because it's like I'm causing their headache pain as I'm doing it. Right, so if they're not doing that, they may just be because some people are cautious, they don't wanna cause pain to the patient, so they really kinda, like, just take it easy, and that will still work, but it does take a lot longer, right? Like, I tend to err on the side of, like, I'm gonna just get in there and, like, work this out because the faster or the deeper I can get, the better it's going to be, the faster it's gonna be, but that comes with a trade-off sometimes because it really flares people up, and so they have to kinda work around that. But the way that so again, I'm gonna share my screen again. This is getting into the next kind of iteration of the Concussion Fix program. But this is the way that I kind of look at it. So this dotted line here, you can see this? Everyone can see this? This dotted line here is kind of like your headache and dizziness, right? Now, at the start, when your headache and dizziness scores are high, you want to be basically all manual therapy. Now, as that starts to come down, you don't have to be all the way back, but then the next step is to start in with proprioceptive rehab. So, like range of motion exercises, kind of the laser headlamps, like getting to know where your head is in space, right? Walking with head turns, maybe a little slow VOR type stuff where you're moving back and forth like this. All of this stuff just improves like your body's awareness of where your head and neck are in space. And then shortly thereafter, you start that. Now you want to start ramping up strengthening, right? And you want to kind of decrease the frequency of manual therapy along the way. So it's kind of this crossover effect that starts to happen. So you don't have to be completely symptom free before you start doing these types of things. But generally, the order is manual therapy, then proprioceptive exercises as the pain has come down pretty substantially. Let's say when you have about a 60 to 70% drop in the pain or the dizziness, now it's time to start ramping up with the proprioception and then integrating after that into the strengthening side of things. Because what happens is like you're noticing that you feel good for like a day or two and then it starts to come back again. So sometimes that just indicates that there's just some weakness there. And by strengthening it, you'll start to get more longevity out of the treatments, meaning that it'll last longer and longer because the weakness often is what comes back into the dysfunction and then causes the symptoms to kind of creep back up again, right? It could also be that they're just not getting to the root cause, right? So on the manual therapy side, maybe they're not getting deep enough, maybe they're not getting to the right tissues, so on and so on. So it could be a combination. So you may ask them like, "Hey, can you dig in and like cause my headache as you're treating me? Because that's really what's going to kind of move the needle and help it to go away." But then also it's start integrating proprioception and strengthening, kind of in a bit of tandem. Um, and yeah, so then that'll give you
the strength you need so that the symptoms don't keep coming back so frequently. Do you know what I mean?
Gotcha. Okay. No,
Yeah.
sounds good. I'll have a chat with them. Just one follow up I have, just in terms of my joint restriction. Earlier, whenever I did get adjusted, it used to come back within an hour, and now it's 2 days. So I guess there's some progress.
Yep.
So my question is, I'm considering traveling for a month, during which I won't have access to my treatment. Would
Yep.
this set back my progress, especially since my neck has not fully resolved yet? Is there anything I can do to maintain my progress?
I mean, obviously, if there's an issue there and it's not being addressed, yeah, things can come back. But if you've gotten to a point now where you're, 90% of the way there, I don't think you're going back to zero, right? And I think just understanding that it's just a neck issue, like, kinda gives you a little bit of confidence to say, like, "Oh, yeah, my neck is just, flaring up again," and you don't start worrying that your brain or is permanent or anything like that. But if you I don't know when you're leaving, but if you could get on some, you know, getting maybe they can give you some self-massage type techniques based on your particular issue that you can do while you're away, giving you a little bit of kinda stretches and stuff you can do while you're traveling to just kinda help stave off, a dramatic decline. I think that would be good.
Okay, that sounds good.
Yeah.
Uh,
I mean, it's part of it, right? Like, if you have to travel, then, you're not gonna have access to things and things can creep up, but sometimes, depending on what you're doing, travel can actually get rid of everything because you're in a relaxing environment, I don't know. I don't know where you're going or what you're doing, but if it's a nice vacation or something, sometimes that can just help to just really calm things down and give your neck the break it needs to just kinda reset. So sometimes it can be very beneficial. So it's hard to say.
I was just gonna say that. I was like, sometimes vacation just takes away that day-to-day stress that we have at home. If you have a seated job, sometimes people aren't sitting anymore when they're on vacation, so they're moving their bodies more, they're feeling more relaxed, and that can actually just, create less issues than you might have when you're home. And I can almost hear Dr. Hrkal suggesting some of the like muscle supportive supplements like magnesium. Of course, he's not here, but if that's something that's appealing to you, you could always send him a direct message, say, hey, I'm going to be traveling. What kind of supplements can I bring with me?
Mhm.
That might help sort of relax muscles while I'm gone and get you through so you can enjoy your vacation.
for sure.
I was talking to somebody, recently. I can't remember if it was on one of these lives or if it was an in-person thing, but, they were saying that they were kinda like 80% of the way there, and then they had this trip to Thailand, and they were in Thailand for a month, and they got to 100% just because they weren't thinking about their symptoms. They were out traveling, out and about, and they would go through a whole day and be like, "Oh, I don't think I had any symptoms today," because it just takes your mind off of it and just puts you in a different environment or whatever. And so that last 20% came from just traveling and getting outside their usual routine and focusing on other things. And yeah, so I mean, there's something to that.
Yeah, we tend to be a lot more present on vacation as well. And when we're present, we're not worrying about the past or sorry, we're not thinking about the past or worrying about the future. And that kind of just allows us to be fully present. It's almost like a built in mindfulness practice sometimes when we're on vacation because we're just living in the moment. And when we live in the moment, our mind doesn't tend to be as busy about all the things that could go wrong and worrying about the things that have happened in the past and predicting the future and, thinking, oh my gosh, what's coming next? It's just kind of allows us to have a break from all that. So there's a lot of kind of subtleties and built in lessons on vacation as well. When it comes to concussion recovery.
Oh, amazing. No, thank you. I was gonna go meet my family, so that's added on stress
Mm.
as it is. But for sure. Thank you.
Yeah, that might be an exception, but
Yeah, good luck. Okay, next up is
Hi, thanks for taking my call. Actually, my questions are probably very related to what's already been discussed. Um, so we won't have to go as deep on my question today. So a few weeks ago, you had suggested that I do some deep tissue work on my neck and inside my mouth, and I have had about at least five or six sessions since then. And I don't really have it. Yeah, as you said, it's very painful when you go deep, very, very painful. But I have no pain, absolutely none afterwards from it. So I know we're probably hitting the right spots and doing it in the right way. Um, but what I have experienced from, I assume it's the neck work, is that now when I walk, and ever since I started this program almost 8 months ago through your program, when I walk, I move my head left and look to the right all the time. I'll go almost a mile and do that, and never had a problem with that. I mean, my vision was still reworking. That helped. But since I've had this neck therapy, now when I move my head left to right, I am, I wouldn't call it dizzy. I am moving to the left. Now I'm moving to, my whole body is shifting. The imbalance is extreme. It's like I'm drunk. That's what I just feel like my whole body just then, I can't walk straight when I'm moving my head left and right. So I don't know. I have taken a little bit of a break from it. I am going to Plasticity next Friday. I'm not sure whether you're familiar with them. They're in Orlando, and doing a 2-hour evaluation. They work mainly with brain injury. And so I'm just trying to figure out what are the next steps. Should I, as I've heard, we're going to have these changes. Obviously, the neck work is probably changing the balance in my head. But what should I be? I don't know really what the next steps should be going forward.
Well, I'm going to share my screen again. So I'm guessing what you're talking about is manual therapy.
Yes.
Yeah.
And it's deep tissue work.
Okay, good. Now, what that's going to do, right? Because the sensors in the muscles of your neck, so the richest area of sensors in your muscles and joints is in your fingers, right? That's why we have such good tactile sensory input from our hands and our fingers. The next highest is in our neck. So our neck tells us a lot about where we are in space. And the sensors pick up tension in muscles. And so what happens is over the years, there's been certain tension that has developed in your neck. And that has told your brain how to calibrate your vestibular system and your visual system. So everything's kind of working together. These three systems are constantly communicating with each other so that we know where we are in space. Now, what happens is when you go in and release muscles, now the tension in those muscles changes. So now your brain's trying to calibrate different input from the neck with the visual and vestibular system. So things are going to feel a bit off until that calibration kind of comes into effect. One way to improve that is now that you're getting manual therapy and you're starting to realize that, okay, some of those symptoms are going down and it's having an effect. Okay, now we should probably start ramping up our proprioceptive rehab, which is kind of what you're doing, where you're turning your head side to side, focus on a target, turn your head side to side slowly like this, and then up and down like this, just back and forth, because that activates the cervical ocular reflex. So that's neck to eyes, okay? So if we just work on those kind of slow head turns, or there's one where you get a laser headlamp and you focus on a target and then you close your eyes, you turn your head all the way to the right, and then you come back to middle, try to feel where midline is for you, and then open your eyes and see, is the laser close to the center, right? If not, is it above, is it below, is it side to side? And then you can kind of readjust, say, put it there again, put it right on the bullseye, close your eyes, turn your head to the right, come back. Okay, now I feel like I'm in neutral, open my eyes. Okay, am I getting closer? So what you're trying to do there is help the sensors in your neck to, be more accurate in telling your brain where you are in space. Because then that starts to improve that. It starts to kind of groove things together, right? So it's almost like you've given yourself a new neck. Now it's time to train it to know where it is in space and help your brain to calibrate with your eyes and your vestibular system. And then the next step on that, like I said, is starting to kind of strengthen things so that you are able to kind of keep it there. Right? So that's kind of the order of things. So you're doing this, you've gotten yourself a new neck. Now it's time to learn how to use it.
Yes. And I was doing months of vestibular therapy before I started doing the deep neck. Um, but I stopped doing the vestibular therapy just because I just can't do everything all at the same time. Uh, do I need to go back to them to do that work? I mean, I kind of felt like I had kind of had hit an impasse with them because my neck has now shifted. You know, I, I never had really neck pain before we started this therapy. I don't have neck pain now, but the brain signals aren't are relearning, right, as you just said. So should I be coupling? Should I continue the deep tissue? Should I restart the rehab? And should I just stay focused on some simple eye movement on my own?
What you can do as like a first step is go back into kind of the VOMS module that's in the program. Take yourself through that self-assessment and see which areas come up for you. And then there's some specific exercises you can do on your own based on what areas are problematic. So that's an easy starting point. But if that doesn't help you after, 3 to 4 weeks, then you may want to consider revisiting either like a concussion provider, or you'll probably learn some things at plasticity that are going to kind of tip you off to some things. They tend to really over focalize on vestibular and ocular motor, though. They tend to kind of not really pay much attention to the neck, even though I think it's a huge mistake. But it'll be interesting to see what they suggest and what they recommend and what they come up with. But yeah, like a simple starting point would be to kind of do that VOM self-assessment, figure out what areas are the most problematic for you, and then do those rehab exercises, continue with the soft tissue work that you're doing. And then if in like 3 to 4 weeks, you're still noticing that that's not improving, right? If it's improving, then you just keep with it. If it's not really improving, then it may be worth getting either an ocular motor assessment from a vision therapy, like neurooptometry person, or vestibular, or even just like a general like MSK physio or PT that can do stabilization and proprioceptive neck retraining exercises.
Okay. Well, that's a lot of data, so I'll have a hard time remembering all that, but I appreciate you sharing. I'll
Okay,
take it one
step one,
Yeah.
keep doing
Step
what you're
one.
doing with neck, but go to the VOMS module in the program and figure out what those issues are. There's like a self-assessment in there, and then there's also the exercises that correspond with those issues. So then you can start doing those, right? Give it 3 to
Yeah,
4
and those were
weeks.
pretty simple. I went through all those at the very beginning, but now everything's shifted. Yeah, everything's shifted with it.
Yeah, go back, because when things shift, there's different things that come up, right? It's all kind of layered.
Right.
And that's my recommendation for everyone in this program, right? For those that have gotten to the end and are now like, oh, I'm still having some issues, the recommendation always is go back to the start and just start over, because there's things that you probably have missed. There's things you've probably let lapse as you've gone through, and there's probably things you're going to pick up the second time you go through it. So just go back to the start and then do it again, because you're looking at it from a whole new lens. Issues have changed and shifted. So now you're going to unlock a whole new set of things, and that's just going to peel back another layer. And then if you get to the end again and you're still not quite there, go right back to the start and start over again, because you're going to just pick things up every time you do it. Things that you've kind of let go, things that you may not have implemented fully the first go. So you just give it another go, and it's going to just peel things off again. And that's the process. Just back to the start, work through it again.
Yeah,
Yes.
there's different layers of that, this like readiness to learn certain aspects of the program, and it comes in different chapters of your recovery journey. So when we say kind of go back to the beginning, it means that you've kind of moved yourself into a different area of your recovery. So you're going to glean new things from the program as you go through. You might have more of a readiness to sort of absorb different material, different invitations that are within the program. So, we always recommend that. I know it can be a time commitment to go back through, but I think, everyone here is committed to recovering as optimally as possible. And so the information that we need to do that is within the program, and each stage of our recovery is going to come with new capacity to absorb different types of information.
Yeah, I remember this was like a couple months ago, somebody commented in the news feed, and they got to the end and they were like, "Hey, I still symptomatic, not sure what to do." And I sent them back to the start, and then they went into your module, Melinda, and started actually implementing all those things because they're like, "Yeah, the first time I went through it, I kind of like just breezed through that." And they're like, "But when I actually went back and did it and like said, okay, I'm gonna actually do this," they were like, that unlocked everything. And then that's what got rid of the rest of their symptoms. So it's something that, it's good to go back and just revisit. And I just can't
Yeah.
emphasize that enough.
It's a readiness thing, right? So, for example, that individual that went through the program might have come into the program with a specific focus, right? My neck's bothering me. So they might have just really kind of went through the program with blinders on until they got to the next section. Then
Mhm.
they focused on that. They get to the end of the program. They realize there's still symptoms. Oh, what's wrong? Why am I not better? I did the neck piece. Okay, let's go back. Right. And then there's more of a willingness and more of a readiness to sort of open their eyes to different invitations that they can find in the program. I always use the word invitations when it comes to psychological things because it's different for everyone. And it might be more recommendations when it comes to Dr. Paul and Dr. Cam's sections. But, there's just different stages of our recovery. And each stage is going to come with a readiness and a willingness to try new things and different things and be open to it. So that's where that recommendation comes from.
Thank you.
Hopefully that helps. Okay, next up is
So I'm getting my neck worked on, have had it worked on twice. It is helping. And she's with Janae Brown. I think you said you knew her.
yeah.
So now when I would, and she said, don't do anything right that hurts. We're gonna work out the pain. It was kind of the opposite of what you're saying. I think you're gone the week I said this. So anyway, now when I run, I'm back to running, and it doesn't like pinch my shoulders or anything. So I on Tuesday tried to incorporate Pilates again, and my entire, I guess it's is it your traps that connects your, like, the top of your shoulders, like from your shoulder to your neck? Is that your trap?
There's a few things in there, yeah.
Okay, so that is insanely sore. My body feels decimated, and I like skipped all the arms, all the anything arms overhead. Like I basically just did lower body when I was there and abs. Or if I did abs, I put a ball behind my head. Like I really specifically was trying not to activate my neck and shoulders. And it now, like a day later, just I completely felt decimated. I was exhausted. My shoulders are so sore. And I also it could have been I had a stressful day. I slept with a hoodie on, like that could have done it. But I think it was related to the Pilates because I had stopped and then I reintroduced it again. So should I just keep going back and just having it worked on and sticking with the cardio? Like, how do I move forward without, it's a very fine line between, like you said, where there is tension, there's weakness. So, and I feel like it's a really fine line between strengthening and aggravating.
Yeah. I mean, this is a common one. Um,
Right.
so typically if people are able to get to full exertion with no issue, right? Like, can you get to full physical exertion while running with no issue? Like,
No, I run and I walk, and they're going to do the Buffalo treadmill test today, I believe, actually.
okay, yeah, good. So if you don't have a threshold for exercise, then you can go and do whatever type of exercise you like. If you do have a threshold for exercise, then we recommend sticking with cardio.
But I guess I want to do the strength training and then why, I guess don't get stuck on the why, but like, why is this? I barely even used my arms or whatever. And I feel like my entire shoulders and neck are like completely stiffened up,
Yeah,
or sore.
that's delayed onset muscle soreness, right? I did a leg workout yesterday. My butt hurts still.
But I didn't even really use them.
Well,
I
you
mean, I guess I
obviously
did.
did. You
I
obviously
obviously
did,
did.
right? And
But
that's
to such
fine.
a minimal degree. Like the rest of my body, I worked out and like it's not really sore. Like my abs are barely sore, my glutes are barely sore, but the part that I barely even used is like, oh my gosh, I feel like it seems so extreme to like the level of nothing that I did.
Yeah, I mean, muscle soreness happens more when the muscles you're using haven't been used in a while, right? So if you've
Right.
been purposely avoiding any type of shoulder or upper body work, the minute you do anything, it's going to cause soreness and stiffness. That is fine. That is a normal physiologic response to exercise. But where it becomes a bit of a confusing picture, and what we're trying to get people to figure out, is isolating variables, right? So
Right.
if if you have like an autonomic threshold, meaning that when you exercise, you get increased symptoms, that means
No, it was just the heart rate's okay. When I increase my heart rate, I feel better and I stay better. I did isolate those. It's the muscle working out that's causing.
now you're into that side of things. So if the autonomic is fine, meaning that you don't have a threshold when you exercise, you don't get increased symptoms when you just do general cardio, then you can go and do whatever exercise you like, whether it be Pilates or whatnot. Now, you're going to have muscle soreness after exercise. That's okay, right? Because if your response is to, well, when I exercise, I get sore, so therefore I'm not going to exercise, you're gonna get weaker and weaker and weaker and weaker and weaker, and it's gonna get worse and worse and worse and worse. So at some point, you have to start. And yes, you're gonna be sore. Is that a concussion problem? No, that's just muscle soreness.
She was kind of saying the opposite of what you were saying though. Like, oh, if it hurts, don't do it. And you say if it hurts, do it.
No,
But
that's not what I'm saying.
or I mean,
What she's saying is that if it hurts in the moment, don't do it. So as you're doing Pilates, if you notice that, like, if I'm doing overhead shoulder press and my shoulder's pinching, then I know that there's something going on with my shoulder and I'm potentially aggravating and injuring something. So I should figure out what that is and I should rehab that first before I go back in doing shoulder press. What you're conflating with that is you're sore the day after. That's just delayed onset muscle soreness. It's called DOMS. That's a normal physiologic response to exercise. That doesn't mean that something's wrong. That's just your muscle's response to, because when you exercise, you tear muscle fibers, you get an inflammatory response, and then that takes a few days to clear. But then the next time you do it, that response will be less. And the next time you do it, it'll be even less. And as you build up strength and endurance in those muscles, the delayed onset muscle soreness will become less and less and less. But at some point, you have to start, right? So it's not that if it hurts, don't do it, because that's still true. If while you're doing it, you're noticing that, oh, that if I turn my head 45 degrees and it pinches, I don't want to keep turning my head 45 degrees and pinch, 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 because I'm just aggravating something that's obviously acutely there, right? But if you just do exercise and you're sore the next day or the day after, right? Like generally it's the next day is it hurts. The 2 days later is when it really flares. And then 3 days later it's starting to get better. And then 4 days later, generally it's kind of dissipated by then. So that's typical for just exercise.
I guess I was just confused because that was literally the area that I skipped. Like the shoulders and the neck were the area that I didn't do those.
You obviously did something to work those.
Right.
Um,
Must have.
so that's fine. If you're getting neck work that's helping, just keep getting the neck work, but keep doing whatever exercise that you enjoy doing.
Yeah, you can just sort of like assess from that, perception aspect too, right? If I get soreness in the area that I perceive to be injured, right, following concussion, I'm more likely to create tension there because I'm going to hold and grip more. So that's actually sort of like a cognitive distortion we can work through. Hold on. Even subconsciously, we can start holding and tensing our muscles when we believe that's like a weak spot, right? A tender spot following concussion. So we might not be able to move through exercise or feel that delayed what did you call it, Cam? Delayed onset muscle soreness, in a way that just feels like, okay, this is normal for me, right? It makes sense to sort of be more hypervigilant about what's happening in those areas that you perceive to still be injured following concussions. So taking a look at that from that perspective, right? Can you allow yourself to or remind yourself that you're safe, right? Okay, hold on. The injury's already resolved itself. I've done the necessary testing to make sure that it is safe to exercise. So I can go forward, doing the things that I'm doing and validate that it's okay to have this muscle soreness. The more we're worried about it and the more we internalize that something might be wrong again, we're likely to just completely tense up. We become hypervigilant, anxiety can set in, and now we're actually just creating an additional problem. So really stating for yourself, okay, I've already had this all checked out. Cam's been able to provide you this evidence on what type of muscle soreness is okay. So bringing that in next time you exercise and say, okay, is this delayed onset muscle soreness? If yes, okay, then I just roll with it. I try to relax things, maybe use a little bit of a heat pad if it's really sore, but reminding yourself that that doesn't mean it's a re-injury. We don't need to become hypervigilant about that area because of the past experiences. Now, that being said, sometimes there is a trauma response following concussion that we instantly go into that hypervigilant state anytime we have a sensation in usually it's the head, neck, and shoulder region. And bringing awareness to that is that first step of recognizing what we might be doing, right? We're trying to protect ourselves, even though we don't need to protect ourselves anymore in that area. Of course, we're not going to go and do things that might really re-injure ourselves, but something like a light Pilates class should typically be safe. Of course, we can't give medical advice, and as long as you've done these tests that will help identify whether there's still an injury there, then working on that perception piece. Am I perceiving that I'm going to re-injure myself? Am I tensing and becoming hypervigilant? Is there anxiety there? These things are all really important too, and likely to create more muscle soreness following exercise.
I guess it's less about like, oh, my neck and shoulders are actually sore. It's just that my whole body feels decimated. It feels like I was so completely exhausted. Like I woke up the next morning and didn't think anything was going to be happening. And then I was like, oh my gosh, I can't even get, like, I just felt so exhausted. My body just felt so exhausted. Not just like, oh, my shoulder hurts. Like, oh, it's sore. It wasn't isolated to my shoulder. It's that my whole body just felt so run down.
Yeah, perhaps it was just too much, right? Maybe we need to scale
Right.
back a little bit.
Yeah,
Right.
or you just haven't done it in a while.
Yeah.
Right? Like
Right.
here's another example, right? Like normally I go to the gym Monday, Wednesday, Friday. I try to go for a run Tuesdays. Um, Thursdays my legs are too sore from leg day on Wednesdays. But I took a week off when I was in Florida, and then I was sick in Florida, so I came back, so I took all of last week off. So now it's been 2 weeks since I've gone to the gym, and I'm doing less weight, less reps because I'm just so much weaker from not having gone in just 2 weeks. And my capacity is such that I am like wiped. Like I could hardly even finish the workout even though I cut it short. And then the next day I'm still like just drained from it. Like I slept almost 10 hours the night after I did my first workout and I was still decimated. So it's just one of those things. If you haven't done that in a while, it's going to be hard. You're going to lose physical capacity very quickly from not having done it. And then when you go to do it, it's going to take you out. But it's going to take a while just to kind of get back into it and build that capacity back up. So this is not a bad sign. This is just response to more workload than you've probably had, working different muscles you haven't worked in a while. And all of that is just the normal part of it, right? So I would start just slow and gradual, right? I wouldn't go like every single day for the next 5 days because you're just going to like kind of overtrain yourself. But if your process now is like, oh, okay, I'm going to start getting back into this maybe once a week, maybe increase it after a few weeks to twice a week, and then maybe 3 times a week or whatever you want to do, you just gradually get back into it. Your capacity will increase, the soreness will decrease, your ability to recover after will improve.
Hmm. And I know we have to wrap up and move on to the next question here, but if that persists, that sort of full body exhaustion persists after you've tried sort of our recommendations, then come back and maybe Dr. Hrkal will have some suggestions around things like mitochondrial support and
Mm,
recovery and things like that.
Okay.
yep.
Thanks. Thanks,
You're
everyone.
That was a great session for today. Thank you. I know you just wanted to come on real quick and say something to everyone. It wasn't necessarily a question, so we do have a couple minutes.
Okay, just super quick, and just to tell Dr. Cam as well. So I've been getting adjustments on my spine, like the C2, C3, C4, the last couple weeks, and I am in absolute shock that I've been able to more than double the amount of time that I can be on screen without any eye pressure. And I was on the elliptical the other day, and I started crying because I was like, oh my God, I don't have any eye pressure doing cardio. And so I feel like, I was talking to you guys for a few weeks being like, I feel like I'm not getting anywhere with the neck work. And I just want to say thank you so much. I'm definitely going to have I think questions coming up, but I'll join next week to ask those. And I just want to say I'm just so grateful and thankful. And I feel like I've made a huge jump in progress these last couple weeks, and I'm just so happy.
Great, good.
Yeah.
That's so good.
That's so
So
great.
thank you. And that's it. But
Yeah.
thank you.
Thanks for sharing.
Yeah.
Later, everyone. Have a great day.
Thanks, guys. Bye. Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.
I feel good.